Why is an emergency contraception an abortion pill? Imagine a way to prevent pregnancy before it even begins. That's what emergency contraception does. It is often called the morning after pill, but it is not the same as an abortion pill. The key difference lies in how and when they work. Emergency contraception works by stopping pregnancy from happening in the first place, while abortion pills are used to end an existing pregnancy. Let's look at how it works. Emergency contraception mainly works by delaying or preventing ovulation, which means it stops the ovary from releasing an egg. Without an egg available, fertilization cannot occur. It may also prevent sperm from reaching the egg, or, in some cases, prevent a fertilized egg from attaching to the uterus. But, importantly, it does not affect an already implanted pregnancy. If a fertilized egg has already attached to the uterine lining, emergency contraception will not terminate that pregnancy. Timing is also a big difference. Emergency contraception is meant to be used within 3 to 5 days after unprotected sex. The sooner it is taken, the more effective it is. It is a preventive measure, not a treatment for pregnancy. On the other hand, abortion pills are used after pregnancy has been confirmed, usually up to 10 weeks after the last menstrual period, to actively end the pregnancy. The purpose of emergency contraception is to prevent pregnancy after contraceptive failure or unprotected sex. It is a safety net, a way to reduce the chance of pregnancy. Abortion pills are a medical treatment to end an existing pregnancy. They involve a different set of medications, usually mifepristone followed by misoprostol, that work to detach and expel the pregnancy from the uterus. There are different types of emergency contraception. The most common are pills containing levonorgestrel, like Plan B, which is available over the counter and works best if taken as soon as possible. Ulipristal acetate, sold as Ella, requires a prescription but can be effective up to 5 days after sex. Copper intrauterine devices can also serve as emergency contraception by preventing fertilization and implantation, but they are not considered abortifacients. Safety is another important aspect. Emergency contraception is safe, effective, and accessible in many places without a prescription. It does not harm an existing pregnancy and is not subject to abortion restrictions. Abortion pills, however, requiring medical supervision and are regulated because they terminate pregnancies. A common misconception is that emergency contraception causes abortion. That is not true. It works by preventing pregnancy before it begins. If a person is already pregnant, emergency contraception will not work and will not harm the pregnancy. It simply cannot terminate an established pregnancy. In summary, emergency contraception is a preventive method designed to stop pregnancy from occurring by delaying ovulation or preventing fertilization. Abortion pills are medications that end an existing pregnancy by blocking hormones necessary to sustain it and causing uterine contractions. The difference in timing, mechanism, and purpose is why emergency contraception is not considered an abortion pill. Always consult a healthcare professional for personalized advice and to understand the options best suited to your reproductive health.